2, 3.
Patient is 43 years old, found lying unconscious in a pool of blood. No visible signs of injury. She's breathing but has low blood pressure, tachycardia of 110, fever of 38.5.
Those symptoms sound like a bleed or a head trauma. Let's get a CT scan set up so we can do a head check.
Whoa, hang on a minute.
And you are?
Hiya, Dr. Bowers, Healthy Liverpool programme. I think we could save you some valuable time.
Yes, of course, that could be helpful.
If you had this patient's entire medical record available to you right now, you see that she has epilepsy and she attends review at the Walton Centre.
So it could actually be a seizure. Thanks. It's probably secondary to infection, so let's get an FBC, U&E, bloods, gases, and a chest x-ray. Nurse Richards, if you could administer a dose of penicillin to be going on with.
Whoa, hold your horses.
Yes, Dr. Bowers?
Little bit more Healthy Liverpool advice for you because I think you could probably use it.
We're all ears.
If you had access to the patient's entire medical record immediately, you'd be able to see she has a fairly serious allergic reaction to penicillin.
Whoa. It's a close shave. We would have lost valuable time. Thank you. Okay, let's go with a different antibiotic. Now let's find out where this bleed is coming from. Nurse Richards, if you could bleep the on-call surgeon for an urgent gastroscopy.
Easy, Tiger.
Dr. Bowers, I'm afraid a gastroscopy is essential given Mrs. Green's condition.
I agree completely. However, if you had access to her medical record immediately, you'd see that she takes warfarin tablets, which thin the blood.
Extremely helpful, Dr. Bowers, thank you. We could have been in for a nasty surprise otherwise. Nurse, if you could check an INR to see if he needs vitamin K.
So as you can see, when health teams have access to the right information in the right place at the right time, the result is safe and effective care 24/7. Unfortunately, as it stands, that isn't always the case. And the information that's shared from your GP to hospital services or to community services is very often shared on paper or fax machine. And that takes precious time that could and must be reduced if we're to improve every aspect of your care. Now, the Healthy Liverpool programme has a new approach to this, a joined-up system where your doctor, your hospital services and community staff will work collaboratively around you. What that means is your doctor, your nurse, your therapist, your mental health practitioner, your support worker will have access to all the information they need to make quicker, safer decisions with you about your care. And they'll ask you permission before they look at any shared information about you, and you don't have to say yes. You can even opt out of the whole thing if you prefer, but we'd rather you didn't opt out because the benefits are really clear and your information will only be used for your care in our region. To find out more about how sharing your record will improve your care, go to www.healthyliverpool.nhs.uk.